This week on Brian Ross Investigates, no matter who's in the White House, what are the three most important steps to fight off the COVID-19 pandemic? What about Thanksgiving, Christmas, and the year-end holidays? Should the U.S. follow Britain's lead and shut down the country for a month? And how soon can we realistically expect a vaccine? We're joined by the former Deputy Surgeon General, Dr. Boris Lushniak, with important words about our public health. Plus, a new lawsuit alleges sales reps for a major healthcare company used gifts of foods and posed as essential personnel to gain access to America's nursing homes.
All Vitas staff are considered essential healthcare workers. Report to work as scheduled. Governor's stay-at-home order does not apply.
Our interview with the woman who would not follow orders.
They brought food, donuts, gifts, whatever they could come up with to try and get themselves in the door.
And this week's winners and losers in the media. See if you agree with the editors of Mediaite about who's on top and who is not. From the Law&Crime Trial Network, this is Brian Ross Investigates. And good evening. Thank you for joining us, and welcome to our viewers on Facebook Live. I'm Brian Ross, joined as always tonight by my colleague at Law&Crime, Rhonda Schwartz. And Rhonda, we begin with the one thing we should know for sure by the end of this week, and that is the COVID-19 pandemic is raging, seemingly out of control, Rhonda.
That's right. It's an enormous spike. It keeps growing. 500,000 new cases just this week, giving the United States the unwelcome distinction of leading the world in new cases and new deaths, Brian.
To get better insight into all this, we're joined tonight by Dr. Boris Lushniak, the former U.S. Public Health Commissioner, acting Surgeon General, and now the Dean of the School of Public Health at the University of Maryland. Dr. Lushniak, thank you so much for joining us.
Thank you for having me on, Brian.
Let me start by asking you, what can be done now? What should we be doing in this country? And what should we do about the upcoming holidays, Thanksgiving, and all the year-end holidays, including Christmas?
Well, first of all, we have to go back to the basics. And to some extent, it is a repetition of the same recommendations public health have been giving to the United States, to the world since all this started. Number one, masks. Get those masks on and wear them with vigor, right? Wear them with the sign of that they're not a political state, but in fact, they are a way of showing that we care for others and we care about our own health. The idea of physical distancing, the idea that we can't get together in groups. Yes, we are all tired of this COVID. There is the concept of COVID fatigue. We need to be able to get out there, right? To be able, through the world of internet, through the world of telephone, old-fashioned letter writing, to connect with people. But group gatherings really are a major problem in terms of the spread of disease. And the third component, which I'll repeat yet again, is washing of hands, making sure that we are clean and not touching our faces and passing diseases on to others. Those are our three critical components. And as we prepare for the holidays coming up, the key feature here is this is going to be a holiday season unlike any others that we have experienced in our lifetimes. And the key component of this is the idea of families gathering together, the idea of many of us sitting in houses or in rooms, eating dinner together. That's going to have to be postponed this year, because the reality is we're seeing spikes because of this regression, if you will, of our awareness of physical and social distancing in the midst of all this. So the holidays celebrate using brand new techniques of connecting with our family members, but avoid the large group gathering.
That's pretty strong medicine for the American public. As an expert in public health, how do you persuade Americans to follow those guidelines?
Well, once again, going back to what Rhonda had just discussed a little while ago, is right now we're not doing well. And right now we're setting ourselves up for a very long winter unless we do this right. What we've seen oftentimes throughout this whole time period of this COVID-19 pandemic is every time we've had large group get-togethers, we've seen huge spikes afterward. And this is measurable after the Memorial Day holiday, after the July 4th holiday, after the Labor Day holiday. The minute that we let down our guard and want to celebrate as if nothing happened, That's where our nation gets into trouble. And what I'm asking people to do is this is sacrifice, but this is sacrifice for the bigger good. And the reality is what? SARS-CoV-2, the virus that causes COVID-19, is transmissible from person to person. If I can drop, right, a curtain in between you and me, I can stop that transmission. And that metaphorical curtain is at times me being separated from others. This is not easy. And as I mentioned earlier, a lot of us have COVID fatigue, right? We're tired of having to live like this. What I'm asking America to do is a little while longer, and we can actually make incredible changes.
Dr. Lushniak, a question for you from Rhonda Schwartz. Rhonda?
So, what about the hope for a vaccine? We saw some trials start with great promise and then they paused, they started again. Are we getting closer to a vaccine?
Rhonda, we definitely are getting closer. It's been an incredible journey in these last, 10, 11 months since all this started. I do want everyone to reflect on the fact that this all started December 31st, was the first time that the World Health Organization office in China was informed of an outbreak, a small outbreak, unknown etiology of diseases, people with pneumonia. So we've been 10 and a half months into this. And especially on the vaccine front, incredible progress. Right now, we have worldwide around 50 vaccines, 50 vaccines that are in some aspect of clinical trials, and over 80 vaccines that are still being tested. So this is a worldwide endeavor. We've made incredible progress, yet we're at the critical point with a handful of vaccines, which is called the phase 3 trials, where all of a sudden the vaccine is being given to larger numbers of people. And now there's a reckoning time, right? There's a time to say, does this work and does this not cause harm, right? Two important facets to this. This is going to take a while. So the way I'm looking at it is, at best, in the first quarter of 21, will we see some vaccines coming to the top that have enough information, have enough of that critical data to be able to be looked at as potential parts of our armamentarium against COVID-19. But I have to stress, Rhonda, and this is really critical, the minute we get a vaccine that's licensed by the FDA in the United States is not the end of this pandemic. This just allows us to utilize a brand new weapon against that. We will continue these other public health measures, wearing the mask, physical distancing, and hand washing for a while into 21 until enough people have the vaccine and we can actually make changes in the environment of COVID-19 as a result of this vaccination program that will likely take place sometime in 21.
All right, Dr. Boris Lushniak, the Dean of the University of Maryland School of Public Health, thank you so much for joining us. Valuable insight. Coming up, allegations against a major U.S. healthcare company. Allegations that sales reps sneaked into nursing homes with gifts of food to sell their services. When we come back, you're watching Brian Ross Investigates on the Law and Crime Trial Network. Whenever that happy day comes when we're back to normal from this COVID-19 pandemic, there will no doubt need to be a number of investigations about what happened during the pandemic. And no doubt one of the focuses has to be on what happened in America's nursing homes, Rhonda.
That's right. 38% of deaths from COVID were nursing home patients and staff in long-term care facilities and nursing homes around the country. 87,000 people, according to a special study by the New York Times.
And one thing that should not be overlooked is what was alleged in a civil lawsuit filed by an employee of a major U.S. healthcare company. She was put on unpaid medical leave after she complained about what was going on.
The lawsuit was filed by a California salesperson for the Vitas healthcare company, which sells hospice care for the elderly. Her name is Kristina Eisenacher.
What raised concerns on my part is that we were ordered to ignore public health officials' orders and go into hospitals, nursing homes, and doctors' offices that stated that they were closed to vendors. And we were instructed specifically to ignore those instructions and rewarded for even sneaking into those facilities if necessary.
And your job was what? To sell what?
My job was to sell hospice.
So you would sneak in essentially. And when you say sneak in, what do you mean?
Well, I wouldn't. Once those orders came down, I refused to participate and sat back while I watched other employees actually sneak into these facilities and were encouraged and rewarded by the management.
As part of her lawsuit, she obtained these pictures taken by colleagues who followed the orders, one with the caption, "Sneaky, sneaky."
What you're seeing in those pictures, Brian, is salespeople taking selfies with doctors, nurses, and administrators at hospitals, nursing homes, and doctors' offices. They brought food, donuts, gifts, whatever they could come up with to try and get themselves in the door.
And at this point, there was a complete ban on people going into nursing homes and various doctors' offices, but your colleagues did.
They did. That's right.
In its promotional videos online, the Vitas company boasts that it has been a leader in providing hospice, end-of-life health care to patients in 14 states and the District of Columbia.
We have over 12,000 professionals with the expertise that comes from helping the thousands of people day and night who depend on us.
Eisenacher says she and other salespeople were told they should consider themselves essential personnel, and therefore restrictions on entering nursing homes did not apply. She received this phone message from the company.
All Vitas staff are considered essential healthcare workers. Report to work as scheduled. Governor's stay-at-home order does not apply. Carry your Vitas badge to identify yourself as a healthcare employee in the event that you require proof of employment.
It seemed that these orders were coming from the top down. This is a company that's in 14 states all over the country. And I knew what they were doing was illegal. And as I watched people on television talking about the outbreaks in nursing homes and in hospitals, and listened to family members crying that they couldn't even visit their dying mothers, fathers, brothers, sisters, I really couldn't stand by and watch this happen without saying anything. So I didn't really feel like I had a choice, Brian.
And yet at the same time that the loved ones can't go in the nursing homes, Vitas salespeople are going in, claiming they're essential personnel?
That's right. And I'd like to add on top of that they were not only going in claiming that they were essential, they were also going in without proper PPE. So even what the quote unquote essential healthcare workers were required to do from a preventative standpoint, Vitas wasn't even observing that.
The president and CEO of Vitas Healthcare, Nick Westfall, declined our invitation to appear on the program and respond to the allegations in the lawsuit. Westfall was in Washington back in March to meet with Vice President Pence and the COVID-19 task force, where the need to protect nursing homes was prioritized.
Generally, we monitor our nursing homes for abuse and neglect, but at the president's direction, we're going to focus exclusively on ensuring that those who are in nursing homes, people operating the nursing homes, like many of the CEOs that we met with today, are complying with the new standards to keep our elderly safe.
The very standards Vitas is accused of violating in the lawsuit. Kay Van Wey is the attorney who brought the case.
There's many hypocrisies associated with the case. First of all, they are a hospice company, and for anyone who's had a loved one being taken care of by hospice, you think of them as people who care about people. And this company, we are concerned, is more concerned about profits than people, because the very people that they're charged with representing are the people that they're endangering. So it's not just that they're endangering their own employees, their own sales force, but they're sending salespeople into nursing homes when they know this is the most vulnerable population. And so what services are they selling they're selling hospice services so that if people get sicker, they benefit. So many levels of hypocrisy.
Okay, there are others who also are part of this lawsuit.
Yes, both before and after we filed the lawsuit, other sales reps, both in California and throughout the United States, have come forward with strikingly similar stories.
What's your status now with the company, Kristina?
That's a great question. I haven't heard a word from them since May.
So you continue to be on unpaid medical leave?
That's right.
And finally, if what you're alleging is true, that's a violation of the California orders about how to deal with COVID-19. Have you been contacted by any investigators for the state of California or for the federal government?
No, I haven't.
That surprised you?
Yeah, it does. As a matter of fact, I did call the local public health authorities when this all first began and checked in with them and said, hey, here's my job. Here's what I'm being asked to do. I understand what your orders are. And am I in violation of your orders by following the directives of my company? And I was told absolutely I was. However, getting anybody to investigate that was something that seemed next to impossible, which is at that point when I decided to contact an attorney.
I want to thank you both for being here very much. We continue to follow the story and keep us posted on any reaction or developments in the case. Thank you both very much.
Will do. Thank you.
In a statement to us from Vitas, the company said its representatives are in fact critical and that the company follows all health guidelines at the state, local, and federal level. Coming up next, winners and losers this week in the media. See what the editors of Mediaite had to say about the prestigious Atlantic magazine. You're watching Brian Ross Investigates on the Law and Crime Trial Network. Time now for this week's winners and losers in the media, as chosen by the editors at Mediaite. And we're joined by the editor-in-chief of Mediaite, Aidan Mclaughlin. Mediaite, of course, like the Law and Crime Trial Network, is part of the Dan Abrams media empire. And Aidan, let's start with your first winner, a surprise, I thought, the New York Post.
That's right. So the New York Post regained access to their Twitter account this week after they were locked out by the platform for posting their Hunter Biden story. Now, I want to bring this to you as a winner with an enormous caveat. This is by no means an endorsement of the New York Post Hunter Biden reporting, which was effectively Oppo research that was pushed by allies of President Donald Trump and laundered through the New York Post, given a sort of tabloid sensibility. The Post came to some sort of conclusions about that story and about Joe Biden's relation to Hunter Biden's business dealings that no other serious news outlet came to those same conclusions. It was rejected by the Wall Street Journal, and many other outlets passed on this story. But Twitter locked New York Post out of its account because it was publishing tweets that included the story in it. And I think that was a step too far. And Twitter actually got a lot of criticism for this. The New York Post published a tabloid story, as the New York Post does. This story, the Hunter Biden thing, is not that much different than a lot of the more sensational stories we had about the Trump campaign in Russia a couple of years ago. So for Twitter to sort of arbitrarily mandate which stories get sort of censored by the platform was really a bad idea, and Twitter realized it and gave the New York Post access back to its account.
Of course, but by banning it, that gave it new oxygen and it spread elsewhere. That became a more legitimate story than the actual story they were talking about.
Totally. The New York Post story, I don't think would have made half the splash it did had Twitter and Facebook not acted to restrict its reach. So I think it sort of outlines the absurdity of these social media platforms trying to select which news stories they approve of and which ones they don't. It also made that New York Post story on Hunter Biden one of the biggest New York Post stories of the year. And they ran several covers on the basis of it.
Right. Let's move now to a loser. This is a switch this year. The loser of most prestigious magazine, Atlantic magazine, chosen as one of your losers. Why is that?
Right. I think it was an interesting selection this week that we had a tabloid like the New York Post as the winner and a venerable magazine like the Atlantic as the loser. But the Atlantic was forced to print a massive 800-word correction to a story that came out this week or last week, and it was also in the magazine. And they eventually retracted the story altogether this week. It was a long-form dive, the piece, into parents in a Tony, Connecticut suburb who are pushing their children into niche sports to give them a leg up when applying to colleges. That's what the story was about. But the piece was written by Ruth Shallett, who back in the 1990s was a pretty popular magazine writer. She wrote for GQ. She was a writer at the New Republic before she flamed out in this pretty shocking plagiarism scandal. Now, after she submitted this piece to The Atlantic, they apparently said, you know, it's been decades. She's been published elsewhere. We're comfortable publishing this piece by her. They ran their fact-checking process on it, which was very thorough. But a Washington Post media critic, Eric Wemple, actually looked into the story and found a series of inaccuracies on it, which were quite glaring. And The Atlantic then did their second fact check, and they deemed that the writer had deceived them. They published this massive and scathing 800-word correction to the piece, eventually retracted it. It's a pretty, it's a bruise for a magazine that has actually a very good reputation for printing factual stories. But I have to say, it sounds like they should have known better.
And they seem to have acknowledged bad judgment.
For sure, yeah. They said that Ruth Shallett deceived them, but that they should have known that, to fact check this more clearly. And, one of the mistakes was a pretty glaring one. One of Ruth Shallett's top sources said that she had a daughter and told some of these elaborate stories about her daughter's sporting activities, and then revealed that she actually didn't have a daughter. And The Atlantic said that even the writer may have actually pushed her source to deceive her.
Amazing, amazing. Well, Aidan Mclaughlin, thank you so much for joining us. We'll be looking forward to seeing you next week to talk about election coverage. That's it for tonight. Thank you so much for joining us. And thanks to the great team at Law and Crime for getting us on and off the air.